we recommend for a particular woman with PCOS really depends on her makeup and what's going on, the cause of the PCOS. PCOS. We love when we have women come to us with PCOS. We have some really great options and we have some great success as well with working with women with PCOS. And the beautiful thing is women with PCOS often don't ovulate, so we actually see AMH levels really, really high. It doesn't mean that egg quality with that high AMH is a good egg quality. However, it does show that there are quite a bit of reserves for a woman that has a high AMH. So a woman that has a high AMH often has a good amount of eggs, a good egg reserve, we like to say. And then we can always help increase the quality of those eggs. With PCOS, there are 4 types in our holistic functional medicine approach to PCOS. The 4 types include insulin resistance, post-pill, inflammation, and other. Those are the 4 categories. So going to insulin resistance, that's the most common cause, or the one that's most well known, I guess I should say, in the Western medicine world. That is the cause and type of PCOS that I learned about. But there are also other causes and root causes of PCOS, including post-pill, meaning the birth control pill. So if a woman has been on birth control pill prior and had regular cycles, and then was on the pill for a year or 2, like multiple years, then oftentimes she will see when coming off the pill that her cycles are not regular and maybe she's not ovulating, and then she might have a PCOS type of picture. Then inflammatory is, as it says, PCOS, the root cause is inflammation. So we see that as well. And indications of this would be the blood test CRP, so C-reactive protein. It's a sign of inflammation. And if that level is high on the blood test, then we look at other factors as well, but we'll consider inflammation as a source of the reason this person has PCOS. And then the last category is other, and that is pretty much a catch-all for anyone that doesn't fall in the first 3 categories, doesn't fall in the insulin resistant category, doesn't fall in the post-pill, post-birth control pill, or doesn't fall in the inflammation category, would be the other category. And oftentimes when we dig in, we find the root cause for those women's PCOS to be maybe adrenal dysfunction is one thing, and then another one, a big one for the other category for PCOS is a genetic component for some women. Supplements that we recommend in PCOS, and really what supplement we recommend for a particular woman with PCOS really depends on her makeup and what's going on, the cause of the PCOS. And there are multiple root causes of PCOS, so we want to dig deep. And then if we do find adrenal dysfunction, which we find in many women, and with PCOS and without, and sometimes we use these adaptogens, often with other women as well. But adaptogens are really great when we see adrenal dysfunction. And the adaptogens we use commonly, licorice is one. We want to be very careful of licorice. I would not use it on your own. I would talk to a holistic provider, functional medicine-based person, just because if somebody's blood pressure is high going into it, licorice can negatively affect your blood pressure, and we don't want to put you at risk for anything as far as hypertension. So just a little aside and warning on that one, but licorice is one adaptogen that we use. Another adaptogen is rhodiola. Rhodiola we use as well as an adaptogen for adrenal stress. We use Sandra as well as an adaptogen. And one of my favorite is ashwagandha. It's a really great adaptogen. There's a lot of research on fertility, especially male fertility, and we're talking about PCOS. It's a great adaptogen for adrenal stress and PCOS. You might have heard that of women being on, or maybe you have been on metformin, prescribed more in the Western world for PCOS. And interestingly enough, some of these other supplements have as good of a track record, if maybe not even better than metformin. So we have these other herbs and supplements that we like to prescribe, so to speak, to women who have the insulin resistance root cause PCOS. And myo-inositol is one of those, and D-chiro combination, we like to see that in a 40-to-1 ratio. Research has shown that's the most effective ratio, in particular for PCOS women. So that's a supplement we love to add a woman's regimen if she has the insulin resistance PCOS. There are also a few other supplements that we like to think about, and one is chromium. It's actually a trace element. However, we usually recommend having guidance, again, with like a holistic provider or a functional medicine trained provider, as there's a fine balance with trace elements, and there could be some negative side effects to overdoing it. So that's why we recommend having guidance of a holistic provider. NAC is another wonderful supplement we love. It's a precursor to glutathione, which is our body's master antioxidant. It's wonderful for women with PCOS, as well as women who don't have PCOS, and men as well, because it just helps improve egg quality and sperm quality, being an antioxidant. And then there are other supplements, herbs that we recommend for women who have the insulin resistant root cause of PCOS. And these include cinnamon, and it helps with blood sugar regulation. Also fenugreek and berberine all have really good data and research to back up their benefits improving insulin resistance for women and men as well, but particularly for PCOS. If you'd like to learn more, please like and subscribe to my channel.